Are you anxious? Are you worried about what's next? After experiencing intense grief and loss, sometimes that can cause anxiety. Or maybe you're kind of an anxious person. You've always kind of struggled with anxiety, and then something bad happens. You lose someone that you love, and the anxiety has just risen to the point of you feel like you don't have control. Maybe that anxiety is like, who's next? What's next? Can I handle this? Can I handle the pain of this grief and loss? Can I handle life? That's what anxiety is. It's this overwhelming internal feeling that is like a ball of negative energy, a ball of chaos. Maybe you feel it in your gut. Maybe you feel it in your head. My name's Cristi Bundukamara. I'm a psychiatric nurse practitioner with over 25 years of clinical experience. But my real experience comes from my life. I have lost 3 children and my husband over the course of 20 years. And as I tell you a little bit about my story, I want to give you hope that this video will give you therapeutic and practical ways in order to manage your anxiety after loss. And I tell my story for 2 reasons. Not to traumatize you, but to let you know that there is hope of controlling that internal chaos. I fight anxiety. That's kind of my personality. Maybe you don't know how to fight anxiety or you don't fight anxiety, but I can tell you that I have it and that it has impacted my life in very big ways. So when my son Reggie was diagnosed with a catastrophic epilepsy that ended up being a neurodegenerative condition and 10 years of medical trauma, I was constantly fighting this fear of his death. And that fear, and if you are in a situation, maybe you've already lost someone, or maybe you're in this anticipatory fear of losing someone that is actually sick, the advice is the same. We can manage our anxiety. So as I was going through this 10 years of medical trauma with Reggie, I was constantly fighting this anxiety and doing things to try to save his life. I never actually considered that he would die until towards the last couple years. But it was full force of like fight. And I can tell you from my physical body scans and brain scans, I have done a number on myself being in this fight or flight for many years. Now my son died after 10 years of medical trauma, and my daughter, Maya, was also affected by this rare neurodegenerative condition, but she was not sick. My husband also genetically had it. And even though the anxiety after his death was like, who's next? Who's next? And I actually began preparing for my husband's death. And in that preparation, what I didn't realize is that my daughter would die. And I always said, because the day that Reggie died, maybe I should have taken him to the hospital several hours earlier, but I didn't. And I went through that whole beat myself up thing. But I always said, if Maya's even sick with a cold, I would take her to the emergency room. And she died in her sleep with no warning. So even though I had that anxiety about her death and what I would do, it didn't stop what was going to happen. My husband ended up dying about 3 years after Maya died. And I remember my first grief was my son Johnny dying in a drowning accident back in 2005. And I remember I was still raising children. I had 6 children left at home, 2 of which were his biological sisters. And I was so afraid, fear, anxiety, is that his death was going to negatively impact my daughters. And those things did happen. And I'm going through that and managing all of that. That's how I created the Mentally Strong Method and, continue to watch my stories in other ways. But I know anxiety, and I know anxiety after grief. So what is anxiety. Anxiety is fear. Whether you know what that fear is or not, anxiety is fear. So it could be fear of the known, right? I am afraid that something else is going to happen. I am afraid that someone is going to, that who's next, who else is going to die. I am afraid that maybe I can't handle the pain of this grief and loss. Or maybe you don't know exactly what you're afraid of. But, just knowing that it's fear, maybe you could, I do thought maps, but you could journal of what are you afraid of? Because anxiety is fear. So what happens in fear? Our body has a natural and good, purposeful response to fear. That is fight, flight, or freeze. And, people don't talk about freeze very often, but we talk about that fight or flight response, right? A bear's chasing you, you are either going to fight it or you're going to run for your life, right? But there are people that just freeze, that their brain stops working because the anxiety is so high. That is our normal response. We all have anxiety. It is a natural and normal part of life, and our body has a way to respond to it. It is how we are supposed to respond to fear. Now, if you are kind of naturally anxious, you have maybe an anxious personality, you've been anxious since you were a small child, this might even be more intense after a loss, right? But after a loss, there's often this anxiety of what am I going to do? I don't even know what I'm afraid of, but I am afraid of going on. I'm afraid of feeling this pain. I'm afraid of what's next. I can give you a perfect example of anxiety that makes sense and is normal, but is impeding function. My daughter, who has her own children, is really struggling with anxiety. Now, she has gone through all the things that I've gone through, right? She's lost her brother Johnny, her brother Reggie, her sister Maya, and her father. And now she is responsible for 2 little children. And she has an irrational fear of them dying. But that makes sense, right? She's had all of these losses. She saw me fight and try to save my children, her siblings, and so she has this irrational fear. And so we have been working on this irrational fear for her. And recently, her littlest got sick, and immediately, she doesn't even call me, immediately she takes them to the emergency room, right? And think back to what I said about after Reggie died, I was like, if Maya even has a cold, I'm taking him to the ER. So I might have caused a little bit of that irrational fear, right? But here she is, she's trying to be a good mom, and her son is sick, takes him to the ER. He is diagnosed with pneumonia and gets some medication, so he needed a doctor intervention, absolutely. But then that night, she didn't sleep. She thought he was dying all night, and so first thing in the morning, she's back at the ER. Now, his status hasn't changed. He's not more sick. He's just not immediately better. And if you have children or if you know anything about medicine, things take some time. And so, she was at the ER for half the day and really anxious, but there was nothing new. And so, again, she was discharged. So she calls me and she says, can I spend the night at your house? Because I can't sleep. And I'm like, okay. So she comes with both kids, and she stays the night. And in the middle of the night, she wakes me up to come and check him. And I go upstairs, and now they're sleeping in the room in which my son Reggie died. And the day that my son Reggie died, we were using a pulse ox to try to take his oxygen, listening to his lungs, and there was some things. And so here I am doing an assessment on a 3-year-old little boy. And, my daughter is very anxious, and she's looking to me to be able to accurately assess. And I had to do these 3 things. And this is the difference between how I'm able to manage my anxiety versus I'm still trying to teach my daughter to manage her anxiety. And this is what I want you to get out of this video. First, I had to physically decrease my anxiety. Anxiety, that fight or flight, that internal energy, is a physical response. Your body is releasing cortisol, the energy is increasing, your heart rate is increasing, your respiration rate is increasing. So the first thing I had to do was physically decrease my respirations, which will decrease my heart rate. That's all I have control of, right? You can't snap your fingers and decrease your heart rate, can't make these symptoms go away, but you have control of your breath. And so there I was, I'm able to do all these three things at the same time, but taking these breaths as I'm number two, thinking rationally, right? Because what is that anxiety that my daughter was experiencing? It was this irrational fear that her son was going to die. Now remember, even though her brother and sister did die, they had a very serious neurodegenerative condition. So it doesn't, really correlate, but it's understandable, right? If you have lost a child and then you're still raising children, you're probably scared to death that this is going to happen again. And so using these three things, so physically decreasing the anxiety, which your breath is what you have right in front of you, and it does decrease your respirations and your heart rate so that you can think rationally. When we go off into catastrophic thought, we're not thinking rationally, right? Yes, you need to be able to guess, maybe he wasn't breathing well and I needed to make a decision to call 911, right? So you do need to be able to think rationally, and that anxiety is also a strength, right? Because if you have control of your anxiety and you get it into a mild, moderate, you can look at the situation and think rationally. And then the third thing is speaking positivity, realistic positivity to yourself. So, for example, I'm taking deep breaths. I'm rationally thinking. I'm looking at him. Now, he is brown in color, like he is a mixed child, and so it is harder to see discoloration. And so were my children. So there's this anxiety of, am I misassessing this, right? So again, deep breathing. We're looking at, like this little O2 monitor, and it's not great, but it's not like urgent. And I was able to physically decrease the physical symptoms of anxiety so that I could rationally think and speak realistic positive thoughts. So my realistic positive thoughts were, his oxygen is okay. He is breathing. He is sleeping comfortably. We are here with him. He has already been seen by a doctor. He is diagnosed. He's on medication. See what I'm saying? Like realistic positive thinking. Don't just say, don't try to tell yourself, nothing's going to happen, right? Because this is the problem, is people are trying to get rid of their anxiety instead of using their anxiety. When you have control of your anxiety, it actually allows you to think very acutely and well, right? Think about an ER doctor or a fighter pilot or someone who has to think on their feet, right? It's not that they don't have anxiety. It's that they have control of their anxiety. Every doctor, and I've worked in the ER as a nurse, we are scared of losing that person, right? We are scared of making a wrong decision, but that allows us to hone in and focus well. So let's review those three things. Get the physical anxiety down. That's an acute situation, but also chronically. If you're like, well, I'm anxious all the time, then you need to get your all the time anxiety down. Because we talk about anxiety as mild, moderate, severe, and panic. During panic, you can't function. You are no use in an emergency situation. You're not functioning. You're not going to work. You're not functioning. In severe, you are impacting your body physically and mentally in in severe ways, right? Like your heart rate's always up. You might experience migraines or other physical symptoms of chronic, stress, depression, and, a diagnosis of like a generalized anxiety disorder, a panic disorder, right? So your baseline anxiety should always be under mild, right? Like you should be aware of your surroundings at all times. But, that mild to moderate is what's normal. Severe to panic. If you're getting into panic sometimes, your chronic level of anxiety is probably naturally high. And just because it's naturally high doesn't mean that you can't bring that down. You're the only one that can bring that down. And that may include medications to help you do that. Absolutely. But you still have to do those three things, whether we're talking about acute anxiety or chronic anxiety, right? Acute means like there's an emergency situation and I have to think, well, like I was talking about with my daughter and her son spending the night, versus chronic where your anxiety is always high. The same is true. You have to physically decrease your anxiety. So if you have chronic anxiety, there's other ways to do that. Breathing exercises is one, medications is another, but I have other videos on like anxieties and strength and how do you actually decrease that chronic anxiety. Number 2 is rational thought. We often go into distorted thinking where we're oh my gosh, he's going to die. Oh my gosh, this, like they're either catastrophizing or distorted thinking that is contributing to the physical symptom of the anxiety, right? So bring the physical symptom down, think rationally, and speak positive words to yourself. Realistic, right? Don't sit around and go, oh, everything's fine, because it might not be fine. Life is hard, and there are things to be anxious about. So when someone says, do not be anxious about anything, that's a spiritual conflict. I struggle with that. Well, I actually hate when people say that because, if you say do not do something, that actually makes our body do it. So it's not about stopping the anxiety. It's about decreasing it to a high-performing, functional thing. So again, I know I'm repeating myself, but it's super important. Physically decrease your anxiety, whether it's acute or chronic. Think rationally and speak positively to yourself. I'm going to go into some questions. Anxiety is a strength is the next video, but here's one. This is from a mother who has lost a child. She said, what if I do miss something and another child dies? That's our biggest fear. And I'm living every mother's worst nightmare. I have lost more than one child. But just because that's my story doesn't mean it's your story. And what I've talked about in this video is the same. We have to decrease the anxiety to a manageable level. It would be foolish of me to say, don't worry, God wouldn't let you lose more than one child. Like, the reality is another bad thing, another horrible thing could happen to you. I hope not. But when all we do is focus on that, that's kind of what we call catastrophic thinking. Like, this horrible thing's happened, and so now this horrible thing is going to happen. And that catastrophic thinking is going to eat you up inside. So again, do those 3 things. Physically decrease your anxiety. Rationally think. When I say rationally think, like, what is the likelihood that you will lose another child, right? Is it very likely? In my case, my, Reggie died in 2016 and Maya had the same disorder, right? So actually there was a pretty big risk, but in my mind, it was going to be 20 years from now, right? Because she wasn't sick. So you have to realistically think positive and use that as an opportunity to enjoy every moment rather than catastrophizing around that, right? We do have to be realistic, but when you rationally think, the likely, and I had to do that with myself when I was sitting there blessing my grandson, and I was being triggered by the day that my son died. But the likelihood that this healthy 3-year-old with, an upper respiratory infection was going to die that night was actually very low. That's what I mean by rational thought. And then positive, realistic things to, help continue to calm your nervous system. Because the more you think about those positives, the more the mental and physical drain that it will have on your body. I hope that helps. I know too well how hard it is losing a child. The next question says, I tend to freeze. What do I do? Well, the same 3 things apply. So the fight, flight, or freeze, it's the same decreasing the physical anxiety. And sometimes when you're frozen, you're like, well, I'm not even reacting, so there's no reason to deep breathe, right? But just know that in you, that freeze is anxiety. So take those deep breaths. Do things to decrease your anxiety. And then when you get into rational thought, your rational thought needs to include an action list. What do I need to do? So I was working with someone recently who lost her husband. And since she lost her husband, she's been in freeze mode, right? She's might lose her house, and she's, she hasn't paid her bills, and just okay, we're going to decrease your anxiety, but now you have to make a list of things to do. And not an exhaustive list. Start with 3 things. What can I do today? 3 simple tasks that I can do today. Not things like save my house, right? Because that's a big thing. And that's more like a goal, not an action, right? An action is something you can do and check it off. So maybe you could call a not-for-profit HUD or something that helps people save their house. Or you could call a bankruptcy lawyer, to see if you could save your house, right? The action list is a one call, not, I got to save my house, right? Because that could just make you freeze more. So if you tend to do the fight, flight, freeze, it's the same thing, but I would just add, as part of your rational thought, some action items that you can make yourself do, right? Because that's a behavior and choice. It is your responsibility. And unfortunately, no one is going to come and save us. Last question. My support system always tells me, do not worry about anything. And now the worst thing has happened to me. So I don't know what the worst thing is for this person's question, but sounds like they were kind of chronically anxious. People always told them not to be anxious. And then now something bad has happened. It's that chronic anxiety now mixed with grief and trauma. Watch more of my videos so that you can understand how to separate that grief and trauma. This video is really talking more about what to do with the anxiety piece. And next, I want you guys to watch Anxiety as a Strength. That's hard to understand or hard to think about, but as I'm talking about this mild, moderate, and severe anxiety, if you are mild anxiety, if you can, it's not do not be anxious, it's manage the anxiety. Bring it down so that it's functional and helps you function. But right now, it's not just about your anxiety, it's about the pain of your grief and loss, and that needs to be dealt with differently. So, Anxiety is a Strength. Watch some of my other videos around grief and trauma as well.